How are you going to deliver on waiting lists if you don't have consultants in the hospital?
If we don't improve those terms and conditions for the future generation of doctors, there'll be nobody here to look after us.
No sooner did the junior doctors go back in than the consultants came out. In the revolving door of medical strikes, this is day 1 of 2 days. Their younger colleagues finished their 5-day strike on Tuesday.
I'm proud of being a doctor and I'm proud of the NHS, but I am sick to death of being told by the politicians that we're doing such a great job and, oh, didn't we do well through COVID? And yet they will not put their hands in their pockets to pay us properly for the jobs that we're doing.
We've seen, tangible and clear pay erosion over the last decade or so, and not just because of the inflation, it's because of systematic underfunding of the health services.
The NHS in England was today effectively operating a Christmas Day service, providing emergency care. At St Thomas's in South London, this theatre stood empty.
During any period of industrial action, we make sure that we try and prioritise all of our most urgent, and certainly our emergency cases, but the cumulative effect is it becomes more and more difficult to make sure you're prioritising effectively. So unfortunately, even in the next couple of days, we will see some relatively urgent cases will require to be rescheduled, including cardiac surgery and some cancer cases.
A rally at BMA House this afternoon with a guest, taking time out from his own strike, RMT boss Mick Lynch.
I think we've got to congratulate the government in so many ways because they've brought together so many people from diverse backgrounds across the country, across every sector.
If the government has any hope that the consultants are going to give up on their industrial action anytime soon, then the atmosphere in that room would tell you that is simply not going to happen. On the other hand, if the consultants hope that the government will go back to the table, will start negotiating, that's not likely to happen soon either.
The government says it has listened to demands on consultants' pensions and has accepted the 6% pay review body recommendation.
They have a generous settlement. It is a final settlement. Of course, my door is open to discuss other issues with the BMA, but this is a final settlement in terms of pay because we have adopted in full the recommendations of the pay review body.
You do know, of course, that there is a degree of concern about the fact that consultants do seem to earn a lot of money and that they are going on strike for what seems to be an awfully big ask.
We understand people's concern about the fact that consultants are paid more than many other healthcare workers, and therefore why are they going on strike? So the reason consultants are going on strike is because our pay has been eroded by 35% over the last 15 years, and so that is having an effect on the workforce, and more consultants are leaving the NHS, choosing to go and work in other countries.
Trust leaders today expressed concern that no other clinicians can provide cover for consultants, meaning the impact was likely to be worse than with the junior doctors. And cumulatively, industrial action over the past 8 months has seen nearly 750,000 appointments cancelled. The consultants have announced 2 more strike dates in August.
Well, with me now is Dr. Vishal Sharma, who's a consultant cardiologist in Liverpool and chairs the British Medical Association's Consultants Committee. Dr. Vishal Sharma, have you painted yourself into a bit of a corner here?
Well, I hope not. We engaged really constructively with officials. So we spoke to civil servants from the Department of Health, from the Number 10's office, and we thought we were making real progress. Up until a week ago, when out of the blue, the ministers essentially have announced that here's 6% and there's no further talks.
So do you think you were quite close to a deal at that point?
We were making progress, and I think both sides, in terms of the officials that we were talking to, I think we both felt, actually, we were making good progress and we're in a good place. And this has really come out of the blue to some extent in terms of not only the offer, but the sort of finality of the offer and the fact that there'd be no more talks from the government side. And that, we feel, is completely unreasonable. So, the way to resolve this is to talk.
So as you see it, it was a political decision, basically, to sort of pull the rug from under your feet?
Yeah, this is a decision that's come from the very top, I think. This is the Prime Minister and, senior ministers in the government saying, we're going to do this.
I suppose the problem for you is that you've got Mick Lynch on side, but it's the public.
So we know from other surveys that the public do support us in this fight, because it's not just about the pay. It's really, for me, what concerns me is the impact all of this pay restraint is actually having, because it really is getting to the point where it's having a real impact on how patients are receiving care, because we are losing doctors. It's no coincidence that the waiting list has been going up and up and up, even before COVID, as pay has been cut year on year. And
I know you're making the point it's not about pay, it's not just about pay, but for the government, they've got to pay the bills, the taxpayer's got to pay the bill. Average basic pay for a consultant is £97,000 a year. If you include non-basic pay, it's £127,000 a year. Isn't the government right to allocate scarce resources to the less well-paid?
So there are a few things to say on that. So the starting salary for a consultant currently is £88,000, which sounds like a lot of money.
That's the starting salary, though.
That's after a long time at medical school, incredibly long training, and for that you are ultimately responsible for patients' lives. You are making decisions that really have big impacts on people. You carry all that responsibility. That works out about £42 an hour. That is not an unreasonable salary for the level of responsibility you have. And all of those other salaries that the government like to quote are not for a standard 40-hour week or whatever. We do a huge number of hours. We cover for absent colleagues. We've got huge vacancies and we pick up extra shifts all the time. And that's why some of those figures sound high, because we're doing sometimes the job of 1.5 people.
Do you think that is getting through to the public, though? Because, most people can only dream of a salary of that level.
So again, we don't expect the public to have sympathy for our earnings or what's happening. What we hope and what we know actually is happening is the patients support the cause, because if we don't actually address this, I think any worker, if they have their pay cut every single year for 15 years, will feel demoralised, they'll feel undervalued, and they'll look to go somewhere else. And that's exactly what consultants are doing. We have agencies from overseas and even governments now actively recruiting and poaching staff from the UK, offering them better conditions and a better salary.
Are you confident that your members aren't working for the private sector on strike days?
So we've been really clear. So it's a complicated situation, but we've been really clear that if you are...
Basically a no, though. You're not confident.
Well no, it's complicated because we are really clear that if you are contracted for the NHS today and tomorrow and you're striking, we are really clear, do not work in the private sector. There's a chance, for example, if something were to happen, people will be called back into work. So essentially, we were really clear about that. But where it becomes slightly complicated is that some people already have pre-existing commitments or contracts with other employers, and because they're not in dispute with private providers, then they still have to work. But a minority...
Isn't that a good look, though, is it? If you're a member of the public who's had their operation cancelled, maybe for the second time, if they see their consultant going off to the private sector?
But they won't see that because we're really clear that if you are contracted for the NHS today, you should not be doing that.
Right.
But some people, as I say, will have pre-existing, sessions booked, and that would involve cancelling other patients.
Can you give patients any hope? When you look at the number of cancelled appointments, consultations, I know you said you were close to a deal with the government. Can you give people any hope that this disruption is going to end?
That really does fall to government. So throughout this, we've been so desperate to talk, so desperate to reach an agreement, and we've tried everything. And even before we went down the road of having, first of all, we had an indicative ballot in February. We tried to get government to listen to our concerns, and that didn't happen. We got a really strong result in that ballot, which is obviously led on to the sort of legal ballot we had recently. But actually, it's the ministers that haven't engaged. We only met Steve Barclay once.
Right.
And he hasn't met us at all since we delivered a really strong mandate for industrial action.
You sound like a very reluctant rebel. Dr. Vishal Sharma, thank you very much for coming into the studio.